Hello, my name is Jennifer Perkins. I'm the Dale Senior Auditor, and I'm going to be narrating this webinar for you today. The webinar is called the Developmental Services Payment Reform Rate Recommendations Based on the Provider Rate Study. It was presented live on July 16th by Clare McFadden, the Developmental Disability Services Division's Director. It was created in collaboration with Burns and Associates, which are the health policy consultants that the state has brought in to help us with our provider rate study. So what are we going to be talking about today? Today, we're going to talk about why the state is doing payment reform. We'll talk about how the rate study fits into payment reform. We'll talk about what a rate is and what the payment reform will mean for individuals, families, and providers. We'll answer the question, what are the benefits of setting uniform rates? We'll describe how the rate study was done. I'll give an example of a rate and the findings of that rate. In the live presentation, there was then a time for discussion and questions. Here, we'll be talking about ways that you can give feedback to the state about the rate study and share your thoughts, and people that you can contact if you need some assistance in creating that feedback before you submit it. So let's cover the basics. The state pays agencies to deliver services to people. We have 10 designated agencies and 5 specialized service agencies here in Vermont. 3,200 Vermonters are served through the home and community-based services. So why is payment reform happening and what problems are we trying to fix? The state needs to know if people received the services that the state paid for. That's a federal requirement from the Centers for Medicaid and Medicare, which you may have heard been mentioned as CMS. Basically, it's a requirement that we know what services have been delivered to people and have some way to account for that. We also need to know that agencies are delivering services to meet people's assessed needs. So there's a difference between knowing that the services that we paid for were delivered and also knowing that the amount of service that the state paid for and that the agencies provided was the right amount for a certain person. One of the problems that we have right now is that there are gaps in the current system for reporting what services people receive. We have a reporting system, but there are huge flaws in it. It's called the Monthly Services Report. You may have heard it been mentioned as the MSR. But it doesn't have all of the services included in the reporting. And the state has looked at the quality of the information that is in the Monthly Services Report, and it's very flawed. So we can't use that data to tell what people have received. So another goal that we have for payment reform is to make sure that money is used fairly and equitably across people and providers. One of the problems right now is that the current process for deciding how much funding is provided to people is not standardized, which means it's not exactly the same for everyone. We have a homegrown tool that was developed many years ago, and it's not a standardized tool. So it doesn't come with specific instructions on how to administer it. And we know there is variation across the state on how they are completed and what questions are asked. So whenever there are those kind of variations, there's always the risk that we may not be getting equitable distribution of our resources. We also see variations in the ability of the people who have to come present at the equity committee or write up the funding proposals to present the person's needs. And whether or not someone gets services should not ever be dependent on the ability of the presenter to make that case. So the state's goal is that someone in Newport who has similar needs to someone, say in Bennington, would get a similar service package. Another problem is that we don't have a standard way of setting a rate. So we have a set rate for service coordination, but we don't have one for other services. And in reality, the agencies are really telling the state the rate that they want for certain services. And the state doesn't have a way to tell whether or not that's accurate. The agencies have told us that it may not be accurate or adequate, and we don't have a standardized way to determine that or to try to fix it right now. So the agencies, as I just mentioned, have told us that the current rates are too low. So one of the problems is that there is not currently a standard way to set those rates to cover costs. And another problem is that the agency's costs go up over time, but their funding does not necessarily go up to match these costs. So if someone was funded 10 years ago, those are still their rates unless their needs have changed. So everything basically stays the same in the system that we have built. And there's no adjustments based on the way we've set it up. We have given incremental cost of living adjustments over time, but no automatic cost of living adjustments or adjustments for someone just because it's been a long time since those rates were set for both providers and for staff. So what is included in payment reform? You'll see on this slide that it's one big picture, but it's broken up into 6 puzzle pieces. So one piece is the service planning and how are service plans developed. Another is the payment method. How does the state pay for those services? Another piece of the puzzle is the standardized assessment. How are people's needs assessed? Another one is the service reporting. How does the state track what services were provided? Another one is accountability. How does the state ensure that people's needs are met and that it paid the right amount? And then the piece you see pulled out is the piece we'll be talking about more specifically today, which is about the rate. It's about how much the state should pay for services. So the one thing we are not changing is service planning. It's still a requirement that each individual have a person-centered plan, and that will not change. But we are talking about how we will pay for the services that are in that plan, and we're talking about all of these other pieces that are related to it. But today, we are just focusing on the rates. So we're going to get into more of the specifics about the provider rate study and what a rate is and why it's important to know. But I also wanted to mention, before we moved on to that part, that we know that people have a lot of questions about different parts, and that we will be canvassing the state and getting feedback. But for today, we're really going to dive more specifically into rates. So what is a rate? A rate is a dollar value for a unit of service for each type of service. For example, the dollar value is $51 for a unit of service, which is an hour of service, for service coordination, which is the type of service. And these are just examples. $100 per day for shared living services is another rate. We have rates for each of the services that are delivered by the agencies, but they are not set in a standard way. And we've heard from the agencies that those rates are too low. So the rate recommendations. Rate recommendations have been made based on the rate study that we'll be describing a little bit further into the webinar. The payment model, which is the way that we will pay these rates to the providers, is still being worked on. The state will determine what it can actually afford to pay, and then those rates will be used in whatever payment model is designed. So we know that all of the services that people are authorized for are not received. And on the other side, we know that the rates are too low. So we're hoping that we can bring those two things together and actually pay a reasonable rate for services that are actually delivered. So what can providers expect? So providers can expect that all agencies will receive the same rate for providing that same service, and that the rates will be used to assign a dollar value to each service that is delivered. Then the state can compare what it paid for service against the value of the services that were delivered to people. So by doing that, we will be able to determine if we ended up paying for service in the correct amount, and we will have financial accountability and we'll have accountability to people. So any family member can get that data, hopefully, and go back to the agency and say, hey, you promised me X in my plan, and it doesn't seem like I got that, and the agency can share with them exactly what they have received. So what can individuals and families expect? Services will still be determined through a person-centered planning process, and that is a federal requirement. We're not changing any of the person-centered planning process. There will still be that process because it's required. It's a federal requirement. So one benefit we thought there might be to the uniform rates is that if you decide to move to another provider, that it's portable and you'll keep the same amount of services because providers will be paid the same rates statewide. So individuals and families may switch providers, move to a different county without impact of your amount of service. So some of the benefits that we're hoping for with this payment reform is more opportunities. So rates will build in time for staff training and for supervision, where the current rates don't have that. And also support for a professional workforce. So we're hoping that we can have wages that are built into these rates that are sufficient to attract people. And that once these rates are set, as things change, like healthcare costs go up, cost of living, we can be aware of what those pressures are and try to adjust. So as I just mentioned, the ability to stay current as costs change is a big benefit to the rate setting, and also staying in the know for accurate, fact-driven reporting to legislatures, stakeholders, and taxpayers about how that money is spent. So we need to be able to say to all of our funders and to other stakeholders and families that we know that we are spending our money in the most cost-effective way, that we know where our money is going, and that it's being used properly. So now for some even heavier lifting. And this is the part in the live presentation that Clare McFadden completed her part and handed it over to Stephen Pulowski, who is the Vice President of Burns and Associates, to talk more specifically about how the rates were actually generated for the recommendations. And some of this may be very nuanced or complex or somewhat confusing. There will be some information at the end about who you can contact for more clarity and more information about the rate studies. And I'll try to explain it in easily understood terms, but I just wanted to say that it's difficult for me to understand, and I had to hear it a few different times. So if you have to go back and replay some of the slides, do that. If you have to reach out to others to try to break it down, the information about how the rates are generated, that's fine too. I don't think that there's an expectation that anyone would hear this information for the first time and be able to understand it right away, because it can be some pretty difficult information to understand. So we're going to review the provider rate study. And as part of that, we're going to talk about how the providers are paid now, how the rate study was done, the sources of information that were used to make the recommendations, He gave an option in the live presentation to review an example of a rate model. I'm actually going to review it for everyone and a summary of the recommendations. We want to start with how providers are paid today. So this is the overview of the current payment method. So when folks go through and get the ISA and a determination is made on what services they need, those services vary from person to person. So in this example, for me, Jennifer, I get 3 services. And through part of the planning process, it's identified how much of each service I need, and then the rate per unit is determined by the provider. So it's which services you're getting, how much of that service you're going to get, and then how much they charge for each unit of that service. That adds up to an annual amount. It's divided by 365 days in the year, and that's how much the provider gets every day for providing services to me. So if you think back to the previous slide a little while ago that had the 6 puzzle pieces on it and how we were only focusing on one piece of that puzzle, this is another way to say the same thing. So in this example, I get service coordination, shared living, and I get employment supports. And the first column is how much money I have in each one of those services. And the way that that was arrived at was that they took the service coordination at 2 hours a week times the rate that the agency charges for that service. And that's how we got the $5,304 that's on the very top. So for each one of those services, we're not talking about whether I got 2 hours a week or whether I got 4 hours a week or 6 hours a week. We're just talking about the actual rate after the provider determines the number of hours that someone is going to get, the rate that is provided per hour or per unit for that service. So you'll see circled in the red, that's the part that we're talking about, and that's the part that the rate study actually looked at. It didn't look at whether or not the person got too much service, too little service, the right amount of service. It just talked about how much was paid for each one of those services to the provider. So what goes into the pot to develop a rate? So the wages for the workers, the wages and benefits for supervisors goes in, the cost for staff using their cars at work, time spent providing services versus time spent in meetings and trainings and doing paperwork, the agency directors, billing staff, and cost for buildings goes in, office space and equipment for workers and supervisors, and benefits like health insurance, vacation, and sick time all go into the pot to consider what a rate to a provider should be. So how was the rate study done? So Burns and Associates collected data from multiple sources. One was the provider survey that was sent out to all of the agencies in the state. So they collected a lot of information from those agencies about what it costs the agency to provide the services that they provide. So where possible, it asked the agencies to report the information that was similar to how the state tells them to track and report now. And Burns and Associates then shared a draft of that with providers and updated the providers as they went along. And they also provided help for providers to complete the survey. Other sources of information was the Bureau of Labor Statistics and the IRS mileage rate. So those also went into how the rates were built. So with all of the information on the previous slide that Burns and Associates gathered, they took all of that information and they developed draft rate models. And there's an example of one of those rate models on the next slide that we're going to walk through together. So this is a rate model example for individual community supports. And to help illustrate this, I'm actually going to use a blue pointer that should, you see it there on the screen now. I'm going to use a little bit of a blue just to try to help point to what we need to be looking at for this. So I'm erasing it now, there. So if you look at this big box, it's actually broken into 3 smaller boxes. So there's a first box, a second box, and a third box. So if we're looking at this first box, this is the direct support staff wages and benefits. The second box is the mileage. See it over here. And the third box is the program support and the admin. So these 3 boxes together total up to what will be the rate for the person. Now, the rate per hour that is paid from the state to the agency is not the same thing as the hourly wage that the direct support staff gets. The rate per hour that the state pays the agency has all of these other costs that the agency has rolled into it. So the cost is different than what the rate that they actually pay the person who's providing that service, the direct care staff rate. The direct care staff wage is one of the things that is included in the rate per hour, but it is not the same thing as the rate per hour. And you'll see that as we walk through this example. So this is for individual community supports. The unit of service is per hour. So we're talking about 1 hour of service. So let's look at the first box. So the percent of direct care staff working full-time is 80%. That's important to know because there's an assumption that full-time direct care staff have a more robust benefits package, and that costs the agency more money to provide. And when we talk about benefits, we're talking about health care costs and paid time off. So that's all included in that. So the direct staff hourly wage is $14.75. The employee benefit rate, it's a percentage of the wages, is 29.5%. And they got that from all the information that the agencies were providing to Burns & Associates about how much they pay to provide benefits. So come up with $19.10 as an hourly staff cost before a productivity adjustment. Now the productivity adjustments are somewhat confusing. So I'm going to go through that pretty detailed. So productivity assumptions really try to separate out how many hours a direct care staff works with an individual who is receiving supports and how many hours of their week they're doing other things, like the things that are listed here: travel time between individuals, attending ISA meetings, progress notes and medical records, employer and one-on-one supervision time, training, and paid time off. So the billable hours that are listed here, those are the hours that the direct care staff spends out of this total hours of 40 hours that they actually spend doing direct service with a person that the agency can bill for. But we know that the agency is paying them for all of their hours. They're paying them to attend the ISA meetings and the progress notes and the one-on-one supervision. So the agency needs to be able to get an amount of money from the state in those 26.59 hours that is enough to cover all of the costs and that person's wage for the 40 hours. So that's how a productivity adjustment is created. And here the adjustment is 1.35. So if you take the hourly staff cost before the productivity adjustment right here, 1910, and you times it by 1.35, you come up with 2576. Then look at the second box, box number 2. You have to add in the number of miles traveled per week, and the providers submitted information to Burns and Associates that the number of mileage that they pay for their provider, for their direct care staff, is on average 150 miles a week. The amount per mile is set by the IRS, the Internal Revenue Service mileage rate, which is the rate that the federal government says should be reimbursed to people who have to use their own vehicles for work purposes. That's 58 cents a mile. So when you do the math on that, it results in $3.27 per hour. The third box is the program support and the admin. And those are percentages as well, based on the information that the agencies provided to Burns and Associates, 10% and 12%. So when you add up the 2576, go to another color here. So when you add up the 2576, the 327, the 373, and the 447, you get a rate per hour of $37.26. That's how each of the rates was created. The rate recommendations were created in a form like this for each one of the services that an agency provides to a person in Vermont. So I wanted to include some of the questions that were asked in the live presentation of the webinar. If you have other questions, on the next couple of slides, I'll be going over where you can get some answers to those questions, where you can submit some feedback if you do have some concerns. But I wanted to include these three. So the first question was, where does the quality of life come in? And the answer is that the quality of life for individuals is evaluated separately through the quality management review process. The state is required to have not just the quality review process, but also have financial accountability in addition to the service quality. So this rate study is related to the financial accountability piece, but just because we're not talking about that quality of life piece for people does not mean that it is not important, because it is extremely important to us that people have an increase in quality of life. Second question, why not just fix the gaps in the reporting? Why create a whole new system? And the answer is that while the gaps in reporting services is an issue, there are other issues that also need resolving, including system funds being distributed with fairness and equity, and addressing the feedback from providers that the rates are too low. So there are other things that we need to fix besides just those gaps, and that's why this is a larger project than just fixing gaps. And the third question, are rates going to be based on keeping someone safe and ensuring basic human rights? I don't want to go back to institutions. And we have heard similar questions brought up recently, so I really wanted to make sure that I included this here, because I think this is really important for everyone to hear and understand, that all of our values remain unchanged, and they are in the DD Act regulations. And we remain absolutely committed to our values. We are not intending to change the superior aspects of our system that are working for so many Vermonters. So our values in Vermont are still the same. They haven't changed. We are looking to increase accountability, not cut costs or services or anything like that with this. So if you have any questions about that or anything else, we're going to talk now about where you can provide that feedback. So a few weeks ago, providers received a similar presentation to this, and they are reviewing it and they're generating some comments. We would like to hear from all of you what your thoughts are on this, and comments on the recommended rate study are being accepted through August 20th. You can email all of your written comments to DSPaymentReform@burnshealthpolicy.com. And if you would like assistance submitting your comments, contact Kirsten Murphy at that email address or that phone number, and she will help you to draft, create, submit your comments in whatever form, written form you want to, whether that's a letter that someone else can then type into an email, or whether that's an email that you want to have someone else type it for you while you talk. There's lots of ways that that can be done. So if you do need assistance with that, please just contact her and let her know that you had viewed the webinar and that you would like to give some feedback and share some of your thoughts on the rate study, and that you would like some assistance with that. So now that you know where to send that feedback, you may be wondering what kind of feedback we're interested in. And that's really up to you. We just want your thoughts. So here are some examples maybe to get you thinking. What are your hopes or concerns about the changing rates that are paid for services? What do you think about agencies being paid the same rate for the same service? And are there other things that we should consider when we're developing these rates that maybe wasn't mentioned in this webinar, or that you feel like hasn't really had a lot of attention paid to it? So those are all some of the thoughts that we had about some feedback, areas of feedback that you could give, but there is no restriction on any of it. So please share any and all of your thoughts on the rate study. And the last slide of this webinar is the contact information for Stephen Pulowski. I have mentioned him several times throughout this webinar. He is the Vice President of Burns Health Policy. Here is his email address and his phone number and his address. And it's also the web address for the company that he works for, Burns and Associates. So feel free to contact him, reach out to him if you want any clarity on the rate study that he did for us here in the state of Vermont. And I want to thank you for having an interest in the rate study and for listening to this webinar. Please feel free to share the webinar with other people, share the information that you saw in the webinar, and to provide any feedback that you may have about the provider rate study.